I'm going to talk through our capacity assessments at the Edinburgh Practice. There are a variety of reasons why a person may seek a capacity assessment, and firstly, it's really important to note that a person should be assumed to have capacity unless they have undergone a comprehensive assessment which shows otherwise, which indicates that they may not have capacity. When carrying out a capacity assessment, there are 4 main areas we're looking for to ascertain whether an individual has capacity. Firstly, the person must be able to understand relevant information and details about the decision at hand. Secondly, they must be able to retain that information for a long enough period of time to make that decision. Thirdly, the person must demonstrate that they are able to weigh up information to help them make that decision. And lastly, they must show that they can communicate their decision consistently over time. A capacity assessment can be necessary to determine if an individual can make decisions independently, or to determine whether an individual may need further support and guidance to make decisions in their life that are in line with their own best interests. The ultimate goal is to protect and empower people who lack capacity. It can be helpful to have a capacity assessment to ensure that any legal decisions which are made in the here and now are not then contested later down the line. A person may lack capacity if they have a brain injury, an intellectual disability, or a diagnosis of dementia. However, it's really important to note that having a diagnosis of one of these conditions or another condition does not mean that a person lacks capacity. They must undergo a comprehensive assessment first to determine whether they have capacity or not. A capacity assessment is specific. And what that means is that it looks at a person's ability to make decisions about a certain aspect of their life. Common reasons that clients come to us for a capacity assessment include decisions about legal matters. So this might include testamentary capacity, which means making changes or updates to your will, to appoint or change powers of attorney, to be included as part of a guardianship application, and to manage finances, make decisions about your finances, or to make decisions about your care needs in the present day or in the future. At the Edinburgh Practice, our capacity assessments are very detailed and thorough. They are in line with best practice guidelines and relevant legal frameworks. There are various steps in our assessment process, which I will now outline briefly. The first step involves meeting with one of our clinicians, usually a clinical psychologist or a consultant psychiatrist, and what will happen at that initial appointment is for them really to get an idea of who you are, the difficulties you're having potentially in the here and now, the decisions that you are looking to make in your life, and also some background history about your life, including your physical health and your mental health. At that appointment, we'll also want to meet with someone who knows you well, who can provide other information about you and your life circumstances. A second really important part of the assessment process involves reviewing any legal documents and also your medical notes to really get a good understanding of your medical history, both physical and mental health. We will arrange to meet with maybe one or maybe a couple of people who know you well to gather collateral information about you. And it's really important that the people we meet with firstly know you well, but also are not involved in the decisions that you wish to make in your life. On occasions, it may be helpful for us to carry out a cognitive assessment, and that's something that we can offer where appropriate on a case-by-case basis. And lastly, once we've pulled all of this information together, what we do is we will meet with you and someone who knows you well to provide a feedback appointment. And at that appointment, we will provide you with the outcome. So that will be our opinion on whether you do have capacity to make the decision at hand, or whether we feel you don't have capacity at the present time to make that decision. And we will discuss with you what that means and also what support may be helpful for you moving forwards. Following the feedback session, we will provide you with a detailed report which outlines the whole assessment process as well as the outcome of the assessment itself.